Call the meeting order. Please rise for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome everybody here and people out in TV land. Next thing I'd like to do is ask for a moment of silence, please. Okay, we'll go ahead and get started. Call roll call. Commissioner Stephen?
Here.
Commissioner Smith?
Here.
Mr. Smith here. Mr. Culberson?
Here.
Mr. Cott?
Here.
Any public comment? I don't think there is. Mark?
No one signed up for public comment today.
Okay, thank you. I guess we'll move
I think there's one that wanted to be at the end of the meeting, like you said.
Okay, thank you, Jeff. Administrative business, Russell, on how to handle this one as far as the update. What I'm going to do is, I'm sorry, we ready?
Yeah.
Okay, update from the health officer first. Come on up, Jamie, if you would. And then we're expecting possibly some calls from our representative from Anna Topeka. If they should call in, we'll stop or we'll do it. We'll get them in and see if there's any questions that any of y'all have. That way we can keep this thing moving. So with that, I'll turn it over to you, Jamie.
I think we do have one senator. I think Senator Pittman's on the line already.
Okay.
So far, that's
okay. Great.
Morning, Commissioners.
Morning.
And good morning, Senator Pittman, if you're on the line.
I am online. Thanks for the welcome. Thanks for the invite. I've got to say up front, I've got about 30 minutes. I've got another committee meeting coming up, but I find it very important to make sure we're having open communication, especially around the vaccines and the COVID pandemic. So I wanted to make the time to be here and help out and help prioritize what we need to prioritize for Lower County.
We appreciate you taking time in your busy schedule.
Sure.
Commissioners, real quick, I'm just going to give the overview where Leavenworth County is in the caseload and such. Currently, we sit at about 5,728 cases. That's since Monday. We will be putting out the update by the end of today with cases from yesterday and today being added in. Just as a reminder, when cases are added, those are not cases that are just in those 48-hour window. Those are cases that we are being notified of, and they are placed on the actual day of when they were tested. So just because cases come in and are added to that does not mean that 100 cases came in the last 48 hours. It means that we are notified of cases that have happened in Leavenworth County and that we are finally notified of those cases. So there is a lag time and delay. Some of those cases are 2 weeks, 21 days, things of that nature, and we put those back onto the specific day. So as we move forward, I just want to have that reminder out, especially for Commissioner Smith, so you understand kind of where those numbers come as well as you're reviewing those. We sit here in Leavenworth County at about 7.61 for positive percentage, and we're about 24.86 cases per day is where we're at. That is a trend down. On every Monday again, Commissioners, we do put out the graphs in regards to those so you can see our trending of what Leavenworth County looks like for that trending down. We are sitting currently at about 227 active cases that the health department is continuing to monitor, which means those individuals are still on isolation. And again, those are cases that we are aware of and we are tracking. We still currently have 8 cases that are in the hospital. That has actually gone up a little bit for Leavenworth County. We were trending right around that 2 to 4. In about the last 2 weeks, we have kind of doubled our numbers a little bit. We've seen more hospitalizations, and we're currently tracking 160 total hospitalizations in our county, but 8 are the current that we are aware of, again, at the health department that we're tracking that are hospitalized. So that's kind of the caseload. I know today the hot topic is vaccines. Currently, on the vaccine, we received 900 doses late yesterday. That will put us up to about 2,100 doses. We've administered 1,100 of those already. And currently, we are going out today and having another clinic, and probably another 300 of those are going to go, as well as tomorrow will be about 700 to 800 of those are going to be in a clinic that it's already scheduled. So our vaccine plan is following. We are in phase 2. Currently, we have gone through healthcare providers. We have gone through first responders. We are working through phase 2 priorities at this moment. As I have spoken with KDHE, it looks like our allocation is going to be 900 a week, right, for this week and potentially next week, with that potentially going up in the future. We have had conversations with the BCG, which is the Boston Consulting Group that's working with KDHE as a consultant in regards to large mass vaccination plans and such. I have put into that group that our plans that have been for pods in years past, as we've done with H1N1 and such, to vaccinate 7,000 to 7,500 a week. So we are pushing that to KDHE so they can understand that when vaccine becomes available, we can handle that. We have plans to handle that, and we can receive that amount of vaccine to be going forward at the health department. The other side that I want everybody to understand on those are doses specifically to the health department. I am not referring to any doses that have gone to hospitals, VAs, Bureau of Prisons, any long-term cares that already have contracts with the CVS, the Omni Group. That is all directly shipped from that to those entities. So these are vaccines that we at the health department are receiving and working. I don't have time to make those phone calls. It doesn't come directly to me. I don't have the numbers of what the VA receives, what the Bureau of Prisons receives, what the Fort receives. They're handling their own vaccine shipments and such. So these doses are ours and what we are providing. So when we say healthcare providers on what we provided, all the urgent cares and doctors' offices and physician groups and things of that nature that we vaccinated, dentist's office, that's part of our dosing that we have to cover, not the hospital staff. They were covered directly as their vaccine came directly to them and their pharmacies. Part of the 7,000 to 7,500 is as we're moving forward through the community phase groups. That's what we're after, and that's what we're after in regards. So that's at 65 and over. That's trying to get us through all the high contact workers. That's trying to get us through any groups that already have not been vaccinated, that should have been vaccinated because of either scheduling, those type of things. That's part of where we're trying to go with our numbers. Our game plan right now for vaccination, we will be having a 65 and over vaccine clinic for 500 people, and that is tomorrow. That's part of the doses out of that 900. They've already been notified. They're already set up. It's already scheduled. We're also working with Council on Aging if there's any sort of transportation needs. And we will be handling that. The other half of those doses are going to high contact workers. So we're kind of doing a 50-50. I'm trying to work through the list. How that list is working, we created a form on the county's website. You can go in, you fill out the form, it gets downloaded, and currently we are about 5,200 people on that list to work through. So that list is going to take a little while, obviously, until we can get vaccine rolling to get through that list, but it has worked for us because that is exactly the list that we used to schedule that first 500. They signed up. It was very simple. We gave them lots, time slots, put them through, and everyone so far that's received that has been very appreciative, and we'll see how that goes on the very first. But that's the game plan moving forward as we're receiving these doses. Hopefully in the next probably 2 to 3 weeks, all school districts will be done. That's part of this plan. They're part of the high contact workers, so school districts meaning the staff, the teachers and such. School nurses were part of healthcare. They're already done, but we will be going through the school districts and providing those as well. It's going to be a process, and it's all based on supply and demand, and unfortunately, the demand is far outweighing the supply that we're receiving in. But my goal is whatever we receive in that week is already scheduled. So if I'm already looking at 900 for next week, we're already planning on what that 900 is going to for next week and have that ready, pre-planned and pre-scheduled.
Jim, can I ask you a question? Maybe I didn't hear it. You said you're keeping count of the ones that the county is handling, but yet the hospitals and other places are getting their supply too. Is that correct?
Yeah.
So how do we know what number that is, or did you say it and I missed it?
I'm sorry.
So we're getting a lot more than just the 900 or 600 in the county. We also have in the hospitals or wherever else are being administered in the county.
The Kansas opened up the kansasvaccine.gov data page. That's showing total doses being distributed out. What's unique in that, though, there's also a federal allocation that goes to federally qualified pharmacies, and that can be redistributed out. And that's not part of the state's numbers. Those are coming to federal locations. So like Bureau of Prisons and some of those type of numbers, those are federal numbers that are not being reported or reported out by state, from my understanding.
Okay.
Hospitals, yes, and that's part of the state numbers early on because that was part of healthcare provider. They got their allotment up front. That's how KU and St. Luke's is going to be providing. I don't know if anyone saw that, but they're starting to open up some availability to their clientele and being able to give some of those shots as well. So it's starting to become a little bit more available and at more locations other than just health departments. But as of right now, our allocation just to the health department in our county is coming to us outside of those federal groups.
Very good.
And Jamie, this is Senator Pittman. I don't know, can you hear me okay online?
Yep.
On that line? On that end? Okay. I want to give you a commendation here, and just, I know it was difficult up front. I know it's been a difficult run through this whole year, but listening to this briefing today, you're obviously on top of it and doing a great job here. I know that, when I've seen Wyandotte County and Johnson County, and they've made some news because they have got a few more resources to tap into, and they have KU Med basically to work with as a partner down there, and they've gotten most of their teachers vaccinated, as you said, and they've got some excess. We're at the state level, we're constrained. I just want to reemphasize it's been federally constrained vaccination dosage, and we get an allocation set up every Wednesday or so, and each county, because we've decided to go with a county distribution pattern, not necessarily all population based. There's a whole formula online that you can see, kansasvaccine.gov. There's a document center, that's under View 121, and it's a vaccine prioritization slide, because I know Commissioner Stephen has some just questions about how are the allocations working. And they go through each week, and they get the input from our health department, from other health departments across the state. They look at how much inventory they have on hand, how much they can store, how much they're delivering, and it gets allocated out in a very constrained way. And goes out, but they have guidelines. Obviously, we all know the guidelines: phase 2, phase 2A. Part of that is we're going to use the guidelines, but we also don't want to sit on dosages. And I think that's an important thing about what Mr. Miller is saying is that he's got 900 folks ready to go for next week. What's important is to get through all those dosages, right? Because we don't want them sitting around. We want to get as much out as possible. I do know also we're in a very fortunate situation in one sense also that the Fort has some vaccines being distributed. All the students, CGS students, I saw that was one of the questions. They're like level 3, it's the lower priority until they get deployed. so they're still sitting waiting for their dosages. I know the VA have got a number of folks through the VFW have told me that they've already gotten their first initial dosages of vaccine, so that's another avenue for especially members of our military community, retiree community, that we can take advantage of. And everybody 70 and 65 and older is now eligible, and the county set up a very nice scheduling tool, I think, for that. And so I think it's really starting to roll out for those folks. And I have gotten the same calls. I'm sure each of the commissioners has gotten. People want to know when they're going to get their dosages, and they do have health conditions. And so, it's about getting in and getting this thing rolling. And I think a lot of our counties weren't ready for that distribution. And there's been, honestly, some reluctance to take the vaccine across many different counties in the state as well that we could talk about. But I just want to emphasize, great job, Jamie. Thanks for that minute.
Thank you, sir. We have any questions from the commissioners, Mike, or anybody?
First of all, Jamie, I just want to express appreciation for everything you've done and let you know, as far as I'm concerned, you have the support of the full commission here for all the actions you've taken. You've been put in a really difficult position, and it's been a hard year. And so in that spirit, I just want to ask these questions, let you know you have our full support. As far as questions, I don't know if Commissioner Smith, did you watch those videos, those orientation videos that we were given, Kansas Association of Counties? I don't know if you watched it, but well, it's very interesting. The gentleman that's the head of the Kansas Association of Health Departments, Mr. Kriegel, was asked about how the Kansas vaccine distribution is made, and they said that Kansas receives the information on a Wednesday, typically on a Wednesday afternoon, from the federal government, and between Wednesday and Friday they determine the allocation to the counties. So basically, and then they ship them out on Friday, and it takes 1 to 5 days for them to get out, and then it repeats every week. Is that
our doses? We're usually late Friday night. We're notified of the potential allocation for the next week. So this Friday we'll be notified in the afternoon usually of what we're going to be notified or what we're going to receive the following week. It's in hopes that we receive it by Tuesday. So ours right now is our game plan is to have clinics set up and ready for that Wednesday and Thursday. It's difficult because you're talking about trying to vaccinate and notify 900 people, but I don't even have the resource or the supply in hand until the night before to do that. So if it doesn't come in and you've got a clinic set up for 8 o'clock that morning, you have a mess to try to notify those people. But I'm trying to stay ahead of that curve and have those clinics set up. So what I've done is it's really I'm using the community clinic as Thursday to give me that buffer time, and usually setting up some sort of organization, a school district, some sort of on the Wednesday, which is much easier to cancel off if we don't receive it than it would be to try to contact 565 and over that are trying to make travel, plans and things to get to a location. But I want it set up because just as Senator Pittman said, we have to get rid of the doses or they're not going to reallocate. They're going to look at that and say, well, you still have 800 in your refrigerator. We're not going to give you another 900. There's no reason for it.
Right.
So mine is we're going to give them. We're going to have them set up. We're going to have them ready. When we're out today, I need to go because I'm part of that. We need to get these vaccines in arms, and we're going to be giving probably close to 500 today, and probably another 500. So I want to be out by Friday. So when they look at that and they allocate, they can say yes. And maybe that will start changing the mind when they look at another county and say, well, we normally would give them 900, but they still have 500. Give them the additional 300. Mm-hmm. And we can start getting.
Makes sense.
So all that is the background to the question, and I know maybe Senator Pittman can address this, or some of the other legislators, or maybe you have the answer. And I've had a lot of people look at this formula online and not quite understand, the formula is designated how much vaccine Leavenworth County gets. Is that based on population under phase 2, or what's your understanding of that?
Well, I mean, Commissioner, we are 6th highest in the entire state right now at receiving the amount. We're tied with Riley County of getting 900. Us and Riley County get 900. The other 5 that beat us are Douglas County, Sedgwick County, Wyandotte County, Shawnee County, and Johnson County. Those are the other 5 that are getting more vaccine than we are currently getting. And if you look at those, it is by metropolitan higher population. All the others are significantly below even the 900. Most counties in the state of Kansas are, if you look on that list, even for this week, we're allocated 100 doses.
Okay. This is a...
Yeah, and
Go ahead.
I'd comment on that, obviously I'm just a legislature, I'm a lawmaker, and I reached out to the the health department secretary, Norman, and I asked them, it was short notice, but I asked if they could come today. They are allocating, they're actually in the process of allocating this morning, but they're absolutely willing to come in to the, another commissioner meeting and brief from, their perspective, anything on the concern to make it very Leavenworth County specific. So I want to make sure you know that there's an invitation that I set up for that to happen so that we can get more clarity there. But when I go out and read it, it looks like population sizes by the priority group in each county. That's really the kind of base number that they're going with when it comes to that allocation formula.
Thanks, Senator. Go ahead, Mike.
Go ahead.
No, go ahead, sir.
The second one is more a county individual question, not quite as broad as that, but we have the website where folks can enter their information to get on the list. Do we have an alternative if they don't have access to computers?
We have individuals that are calling in. If they call in to get onto the list because they don't have computer access, we have people that are answering the phone, and they will log it in right there for them and put them into. We also have individuals that don't have email addresses. What we are trying to push, though, is when you are trying to schedule 500 appointments, making 500 phone calls is not a very efficient way to have someone's use of time. Email blasts are very easy to say, here's your time, here's your slot, here's where you need to go, and it works real well. We're asking individuals if they don't have an email address for maybe it's a mother or a father that's in that 65. You can use someone else within the family's email address. That's all that's coming is you need to have this person here at this time, this date. So an email address is extremely important to us. If not, we will make a phone call out. But the less phone calls that we need to make, the more efficient I can. Again, I'm a staff of 16 people out there, still trying to do testing, still trying to do quarantine and isolation, still trying to do contact tracing, and still trying to do this vaccine campaign.
I think the word is in what we're saying here is folks use the email. Is a high percentage using that for the setting it up, Jamie?
Is that
what most people are doing?
Yeah. The easiest way is if people sign up and they use an email address, we will be able to, again, sign them up quicker. Even if it's a family member, it'll go to a family member. And most of these people are going to get a ride to there anyway from a family member. That's what we've received, especially when we're starting to get to 80-year-olds and 85-year-olds and such. It's better anyway to have an email address of someone else, because again, the more that email goes out to individuals within that family, the better off it's going to be that they don't miss the appointment either. Because it's very important when we have them on the list and we schedule them, we have their vaccine at that moment for them, and I don't want to have them miss a time and then have to try to reschedule them, because again, they're obviously the high priority for us right at the moment, and that's what we want to do.
Thank you.
And Mr. Mayor, you said that Council on Aging is stepping up as well.
That's correct.
Okay.
I have had conversations with Council on Aging. They are going to dedicate specific drivers, and we're working on the time when the clinics are that they can. We're working with them so that individuals that need transportation could call the Council on Aging and work up that transportation, and we will work with them on what time works best so we can get the best also out of. If it's a bus or a van or whatever we're going to use, to get as many people in using that transportation as well. So we're not just a one in, one out.
And that's throughout the county.
That's correct.
I'm glad to hear. Yep.
So and we had visited this before, but on the distribution, the state decision-making body or whoever it is that's making this decision, you're saying they're strictly using a formula and they're just sticking in the numbers, and that's how the decision is being made.
That's right. And, there's always going to be speculation. There's some kind of political motivation. There is no political motive. This is, there's Republicans, Democrats across the whole state, and there's absolutely nothing to do with politics. It's really about the numbers, the inventory that one has, the population at risk, as well as, the supply they're getting from the federal government, which has fluctuated quite a bit. And then there's also they can make, if for example, if Miller makes some requests for extra dosages as a provider, they can try and accommodate that. They're not able to much right now, but they can make some individual kind of adjustments as needed. There are some special situations and things like that, but it's kind of rare right now. On my understanding, from when I've called in and asked those same kind of questions.
Thank you. Go ahead, Mike.
Which individuals within the groups in Phase 2, are you pretty much following the CDC as far as Phase 2, or did you make some adjustments?
We have to follow the state vaccine. It's basically the vaccination plans and phases that the state put out. And that's what KDHE has given us. Of these, here are your doses. This is what we want. Now, within that phase, we can prioritize, who within those that we think are more important for our community to do. But I can't drop and say it doesn't matter. I'm just going to do.
I guess within what I was asking is within the
phase, yes.
What have you made any priority decisions that are a little different than
we talked at we think it's important that one, we start hitting the 65 and over, as that is a phase and a prioritization. We have also stated that first responders, we knock them out first. With a group, we still have a little bit of some of those that need to be caught up that weren't available on the first offerings. But then we're into high contact workers, which is what we see right now. We're having a lot of issues since schools have gone back in, school teachers and such. So we're hitting half of the doses to school districts, which are a lot of individuals that we're going to be able to do, and then half of the other doses right at the moment are also going to be going to the 65 and over. So once we get through these next couple weeks to get all the first vaccine on board for those, then we're going to be moving through some of those other phases and high contact workers and moving forward just methodically through the list that we have.
Okay,
and I'll say that the state has used the CDC guidelines as the initial starting point, but every state has some discretion on how they use those. And then, quite honestly, each county has discretion and flexibility on how they prioritize, just like Mr. Miller was talking about. It's about the state offered to give you more local control on this, so that the county is actually in control of priorities to an extent within those.
There's a program apparently some of the pharmacies are participating in that, and I guess is that a federal program or a state program, and do you know what pharmacies are being included, and do you have control? I mean, are those numbers anywhere? What relation do you have with those?
Federal contract with Omnicare through CVS is what you're referring to, I'm assuming.
Well, Tonganoxie and Base are the two pharmacies that are promoting that they're going to be getting vaccine.
They're going to be part of it once vaccine is available. And
right.
That's just like any other providers that are out there. This is just like H1N1. There are providers that have signed up. Vaccine is not being dedicated to those pharmacies. They will be providers for once there is enough vaccine to be spread amongst everyone to help in that campaign, so it's not just on a local health department.
Will that come from the Leavenworth County Health Department to them, or will they get it separately?
That I don't have the specifics on. It may be part when these large vaccine numbers come, we may be the central distribution point like we did during H1N1, where we then started becoming the distribution point out to all of those entities, which would be also primary care offices, doctors' offices, pharmacies. We provided those doses to those entities during that time. That's still being worked through, and that's almost at a county by county level. whether that's going to happen or not.
Okay.
I don't have a problem if they want to do that if it gets quicker to us, but right at the moment it's also more work because now we have logistic factors of all of this vaccine here, and we have to be that central distribution point for our county as well.
I think something that needs to be people need to be reminded of, and much to Jamie's participation as well, is a great deal of practice and for distribution of mass inoculations has occurred within our county in participation with. You might kind of give it. I mean, it's an incredible plan that was put in place.
We have pod plans, obviously clear back from H1N1 and such. When we had H1N1, we were doing vaccine campaigns. I don't know how many remember, but the old Food for Less building, which is the Genesis Health Club, we set up a vaccination plan there, and we vaccinated over 8,000 people in one day. So we can be very successful, and the biggest thing here is having the supply to do it. And quite frankly, we're not at that point for enough supply to even, and I can't wait and stockpile 8,000 to do one. It would take weeks to get to that level. So we're in smaller, obviously, clinics right at the moment. We're handling that. We're going out. We're doing. I think where we're at right now is a county level with the supply that's coming in. The health department is getting it out as quickly as we can. And again, it's logistics when you're being notified on a Friday. It doesn't show up until a Tuesday, and you have to be ready to get it out so you can prove on Friday you have no additional doses on hand to continue to get those next doses for the next week and keep moving forward. And that's what I'm focusing in on right now with staff. Again, amongst still testing, still trying to do all the other work that the health department has to do in regards to this campaign, on top of all the other things that we still have to do as a health department with STDs and all the other things that are still here within our county that didn't go away. And I'm still
there's one other thing, there might have been some confusion about the pharmacies too. There was a program with Pfizer, I know, to get to basically coordinate through their distribution channels the Pfizer vaccine to nursing homes, right?
Yeah,
as well as to the hospitals.
Jeff, that's
outside of the scope of. Yep.
Yeah, that's the
and
Pfizer.
That might have caused. Okay,
Sorry.
Go ahead.
Sorry, go ahead.
Go ahead. No, I was just going to say that's the Pfizer. It's the Pfizer vaccine. It's a very specific program that goes out to the hospitals and the nursing homes. It's being conducted outside of the scope of the health department allocation, but it is, that can cause some confusion because those are major pharmacies. I think that people would assume when they hear that name that they can just go in and get it from maybe a CVS, but those are specific programs that they're using to run to those specific entities, and that's had some challenges as well, getting the hospital staff vaccinated as well as the nursing homes informed and on board with that program.
Yeah, and that program again is through Omnicare that's a federal contract with CVS directly, and those nursing homes, long-term care facilities had to sign up with those pharmacies. I think what Commissioner Stevens is referring to is some local pharmacies that are signing up as providers, and as we roll down the path of this, they're trying to step up and be proactive and say, give us doses and we'll help give that. That is going to be something that the state, because those are internal state providers and they're not part of the Omnicare contract.
And they're beginning to train technicians, right, so that they can, the CVS system, I think that I understand, technicians to be able to administer the vaccines as opposed to the pharmacists themselves, so that the pharmacists, kind of like what you're, they can do what they need to be doing, and that they have technicians that are trained. And I think one of the things that Jamie needs to also point out with all the time constraints and people and the number of people is that every time somebody gets the vaccine, they have to sit and wait 15 minutes for adverse effects before they can cut them loose to go. So there's a lot of planning and logistics that has to take place.
Yeah, and again, just because we're given a vaccine doesn't mean we still don't have to try to social distance and wear masks and do all the proper PPE in the mix of it all. So there's a lot of moving pieces to this. What I can tell you is I'm very confident in the health department where we're at right at the moment. I know there's a lot of frustration amongst the community, and we don't think we're rolling things out. What I can say is I even said to Mr. Richmond, patience. We are doing everything. I can assure you we are doing everything we can. We are not sitting on doses. When the doses come, we are moving forward. We are getting vaccine in arms as quick as we can get it.
Jamie, I've noticed what you've been doing the last, even before I came on the board, what you're doing with your small staff is unbelievable. So as one county commissioner, I can tell you, I think you're on top of this, and I appreciate everything you're doing. We're just trying to, a lot of us are just trying to make sure we get that information out, and I know you got your hands full with everything else, so please don't take these questions or anything like that we're not happy with you, because personally speaking, as the new chair, thank you, Jeff, I'm very pleased the way y'all are handling this and keeping me informed.
Yep. I think that's true for everybody. Another question that came up was about this at Kmart on State Avenue. They have a mass vaccination center. First, are you going to be doing something along those lines? And then secondly is, at the end of the day, I have 3, 4, 5 couples that have, elderly people have gone in, got in line, and gotten vaccinated over there. But then there's been other people that have gone over there, and they've been informed that Leavenworth County folks are not going to be allowed to be vaccinated there. So when we set up ours, are we going to be county specific, or are we going to allow? I mean, what's the intent of
our
this?
doses really are for our constituents. I mean, that's really where we will do everything in our power to get it into our residents first. I mean, that's the priority that I have. Unless the board directs me different, I really should be going after our taxpayers. That's what I'm here for. These minimal amount of doses that are coming to us should be going into arms in individuals that live and reside within Leavenworth County.
And I'm sure the people in Wyandotte County feel the exact same way about anybody from Leavenworth County that scooted on over and took advantage of.
You don't want to waste the vaccine, though. If they're not.
I'm sure he's got a list of people to call.
Yeah.
We have a list, and again, I can assure you that on a list of 5,000, at the end of a day, if I have a dose, I can call the next person on the list. If they can't be there I can call, and one of those will be in within 10 or 15 minutes to get their dose.
Okay.
And if you can't, we have 400 employees here that on the payroll that be directed to go there.
We will get it. There has been no wasted doses. And actually, out of a vial of 10, we have actually been able to pull, because there's about an extra dose almost for every vial that's out. And because of how we're drawing and everything else, we're able to almost pull an extra dose out of the vial and be able to still administer that as well.
Good.
I think Senator
Do you know if the prisoners, the number of vaccinations that the prisoners have received or staff at the prison, does that?
We're not handling that. That's all through AHE.
So I made an inquiry on that front with Lee Norman.
The question is, does that number at the prison toll against our percentage that we get of vaccine?
I don't believe so.
I don't believe so either, Commissioner. And when I asked Lee Norman if we had vaccinated any prisoners yet in the state, and we have not yet vaccinated prisoners. They were not in part of the early stages. They are part of the congregate housing. We need to protect our state workers, obviously. We protect our state workers. We help protect our community. But no prisoners have been vaccinated up to this point, although by the end of the phase, I'm sure there will be prisoners being vaccinated.
But the prisoners' vaccinations are not going to count against the percent that Leavenworth County is going to get, to your understanding.
I'm going to ask the Secretary and make sure, but my understanding is that it doesn't count against our allocation, because that would be unfair. And I'll push for that for sure.
Thank you.
Anything else, Mike?
I sent you 13 questions, but in your presentation you answered all but about 3 or 4 of them.
Yeah.
So I think we've given a lot of good information for folks.
Okay.
And thank you, Senator Pittman, for calling in. It's really appreciated.
Absolutely. I appreciate the questions. I appreciate the opportunity, the invitation. I am going to hop off here. I think it's really important that we continue to have open communication as it affects the lives of our constituency, as you know. and it's our duty to help them out and help facilitate as much as we can their safety here. So thanks so much for all you guys do.
All right. Thank you, Senator. Thank you, Senator. Appreciate it.
All right, bye-bye.
Questions, Mike?
Yeah. Go ahead.
Jamie, are we getting the Moderna or the Pfizer or both?
We have Moderna.
Moderna.
And the reason that we do not have Pfizer is I do not have ultra-cold storage.
Okay. And
So I
are
don't
they
have the ability to take Pfizer right at the moment.
okay? Are we going to eventually get both? You think?
Ultra-cold freezers have been on back order since, I think, July, when it was known that it was going to be needed.
Okay.
And
Oh boy.
Okay. So that's
there's
it.
just no...
And,
Of course they are.
and are they both two shot?
Yeah, and so a lot of the Pfizer stuff is going directly to hospitals because the ultra-cold storage is already there.
Okay.
And then counties that have like regional hospitals and such, they can send it to there, and it's being held there in their ultra-cold storage. So
And-
my push is Moderna is an easier
And are they
vaccine
both?
for us to manage right at the moment also.
And are they both two shot vaccinations? Or you need two
Both
shots?
shot,
Are they both two shot vaccinations?
Yes.
Moderna and Pfizer are both two shot.
different amount of time between, right?
Yeah, like a Pfizer is 21 days and Moderna is 28 days
In between the shots.
in between each shot.
Okay.
And again, what we're on that 900, that does not include our second dose. So if we have second doses that are due in that 28-day window for that week, we will also receive those additional doses. So as we move forward, secondary dose, those doses that are being pushed out, I think that's very important to also understand. When it shows 900 is 900 new individuals per shot.
Okay.
Not
The whole.
And is this
whole allotment.
Yeah.
So I don't have to hold back, it's not 450 and hold back 450 because I'm going to need in 28 days.
Okay.
We're doing the whole 900 as first shot. And then in 28 days from now, 26 days, we will receive another 900 for that second dose for those 900.
And that
I
was
think there's a lot of people on social media that have that very confused.
and that was
Very confused.
and that was kind of my next question is the same shot the first shot and the second shot, are they the same?
No, exactly the same shot.
Okay, they're not
It's just
different for the
considered a
second
booster.
shot. Okay.
Yeah.
Okay.
Yeah, all it is a booster. So the first is for your body to recognize, the second is the booster to produce.
Okay. 'Cause a lot of people
My
have
wife
that
works for
wrong, too.
HCA, and they used a lot of nursing students and to help administer. And they were able to. I mean, it was thousands of people in the healthcare through I think 8 hospitals. Is that something we could look at? Retired nurses
we
or
have contact. When we did the H1N1, we used St. Mary's nursing students. The advantage is that the COVID vaccine can also be administered by EMTs, paramedics, and such. So we have additional staff. The issue is not really on the person that's doing this. It's all the logistics up in front, which is all the ancillaries, the paperwork. It's making sure everything is correct before we can do this. So this is the easy part. It's everything up in the forefront is what we have to make sure that.
do you need more staff from us at this point?
Well, I'm
Okay.
working with Mark, and we're trying to identify and trying to get, because as we go through, we're going to have to, the data entry of getting those shots in the computer is the important, so the state knows how many we did and such. So that's the hard part. This is the easy part when it really becomes the backside of making sure that it's all getting into the system and that everybody knows exactly what we did.
Okay. Thank you, Jamie. Appreciate you.
Thanks for taking time out of your busy schedule.
Next thing we have on the line is driveway relocation.
Well, we got to do administrative business.
Oh, yeah. We got Mark?
Yeah, Mr. Lawford.
Yeah.
Yep. So the next item is the driveway relocation cost. This is a follow-up from last week. The Board of County Commissioners on 178th Street, you heard from Bill Knoll last week about a certain driveway that there's a grade issue. You asked him to come up with a potential cost and a solution if the board wants to go that direction, and Mr. Knoll is here.
There he is.
So for your consideration today, I believe you received an email from myself outlined. Obviously, you have several choices. The driveway was built to design specifications, although it is considerably steeper than the previous driveway for the residents. At this time, I'd say you have a couple of choices. One, to keep the construction as is, to relocate the property, or relocate the driveway to the north end of the property. I would suggest that we do it as a allocation, not to exceed amount, where the property owner is responsible for the contractual services of that in order to avoid any legal agreements beyond the right-of-way for the temporary construction easements that were on the project. We could receive those receipts to a certain extent approved by the Board of County Commissioners. If the property owner then is still not satisfied with the improvements made, their recourse is directly with the contractor and not through the county.
So the first option is obviously what it is. It is. That was what was designed. That's what was built. It meets the design specs. If the board, but the homeowner has taken exception to that. If the board is interested in moving forward and fixing that issue to bring it in line with more in line with what the homeowner would like, there's a cost to that. It's probably somewhere between $5,000 and $10,000. So if that's the way the board wants to go, the recommendation from staff would be you just allow the homeowner to go out and contract that in an amount not to exceed, and then we'll reimburse them for that expense so that we're not on private property and we're not involved with a third party.
Yeah. Okay. Makes sense.
And it would bring the driveway into compliance for spacing requirements, because it doesn't meet spacing requirements at this time with the next driveway.
Well, it actually,
or would it still not meet spacing requirements?
It would meet spacing requirements, but under the current county access management policy on a local road, it does. We really don't have a lot of spacing requirements left within the local roadway. Mm-hmm. It's not a collector or an arterial road, so currently it is about 25 feet from the neighboring driveway, which isn't ideal. Obviously.
You wouldn't approve that if there was a new driveway?
No, we would not.
Okay.
It was just an existing driveway, grandfathered in.
Yep.
It's on top of the hill. It's best sight distance, but it is pretty steep.
So I have a question, and Doug, maybe you can answer this.
Mm-hmm.
Throughout the 25 years or the history of Leavenworth County, when these situations come up, is it typical that this is the action we would take, that we would eat the cost of the driveway, or would this be set
years ago? The county would have just went in there and done it without any right of entry or hold harmless claims and just fixed it.
So we would have taken care of it in the past.
Yes, on a project that we did, but this was a contract project. Now I know there's been some issues when another a contractor done it, like on County Road 2, they had one that, but they didn't contact the county for several years afterwards that their trailer drug going out of their driveway. But it wasn't their residential, it was just a field entrance or a farm entrance. But on something like this, yeah, the county would have fixed it.
So,
but
I mean,
we've gotten away
I'll
from
take your recommendation.
we've gotten away from county working off the right of way, and that's the way it should be. We should not be working off right of way. We should only work in the right of way.
I agree.
But how many $1,000 project was this? What was the total price tag on this project?
Total with the design and inspection, approximately 700.
700, yeah.
Yeah.
So
Drop.
you're not talking too much on it. And it wasn't a change order. They didn't bring a change order
back to
for
us.
us.
Yeah.
And they couldn't cut this driveway down anymore because of the water line.
Yeah.
And the water lines are in private easement, so we would have had to pay for relocation of that to make this fit. So.
You know, a lot of times when you do these things, each one can be a little bit different. Mm-hmm. And this one definitely is outside the thing, and especially with the project being that high, I don't see a problem, my opinion only, I don't see a problem go ahead and correcting that.
But the water lines are going to have to be moved now if you cut it.
No, if you go down the hill,
move it.
Yeah, it's not a steep bank when they move the driveway.
I see.
I don't know if I got I don't have it with me.
Yeah, but the existing driveway, the way it's built now, meets the minimum standards of.
It meets KDOT minimum standards. KDOT allows for a 15-degree incline on a driveway, and it was designed at 15 degrees. The property owner had concerns when it was built, and Line Weaver Construction worked with them for no change order and cut it back an additional 10 feet. So as constructed, I think it's around 13.8%, just under 14%. And so that is within KDOT design specifications. So the design engineer was not outside of the commonly accepted practices with the design of the driveway. It's just, it is steeper than what was previously there.
So as a staff, basically, do you have a specific recommendation on this? Or do you just want us to make a policy decision here ourselves?
I think the recommendation is either accept it and move on, and we'll send a letter to the property owner, or if you're okay with it being fixed, then just authorize an amount not to exceed $10,000 or $5,000 or whatever it is, and we will work with the property owner for them to go get that done, and we'll reimburse them when it works.
Okay.
So that's
So
just
moved.
one.
But we need to figure out how much do we want to, not to exceed, and
That's
and
it.
whether I agree or not, it's just to put it out there. Does the property owner have any financial responsibility for assisting with either cost sharing, or do we want to cover the entire cost of? So that would take it probably not to exceed 10,000. But if we were kind of try to share the cost of it, would it then be not to exceed 5,000 or whatever? I'm just.
This was a PRP project, so right-of-way wasn't purchased. They donated the right-of-way. Am I correct on that?
Well, my issue with it is I don't want to start opening that Pandora's box where if somebody doesn't like the grade, just even if it meets the standards, they just don't like it, well, we'll pay for it. So we need to also, I think, look at setting some policy in place that says we'll make ours 10 degree instead of 15. And then there's a hard black and white figure so that down the road somebody just doesn't like the elevation or the grade, they can come to us and say, hey, we don't like it. So
Yeah. Well, like if the water line wouldn't have been an issue, it would have probably been cut back a lot more. But
you see what I'm saying?
Yeah, I know what you're saying.
We need to set a precedent and say, hey, it's going to be 10 degrees now instead of 15. Then that's
We
it.
don't have a blank checkbook. I think every each one of them we have to look at a little different. I think the water line and a few other things have been brought up makes maybe this to an exception. But I totally agree with you, Jeff, what you're trying to.
They're worried about their trailer not dragging coming out. Too.
Yeah, I understand. I'm just saying I think we need to set
Back it up a little bit.
set a precedent, set an exact.
What is acceptable?
Yeah,
and
set
this
an
is
exact
it. We're,
black
we're,
and white. Hey, if it's 10 degrees, it's 10 degrees. If it's 9, just because you don't like it doesn't mean we're going to fix it for you.
I agree.
That's all.
But for this one, where are we at?
Well, we also cut the hill down too in front of the house, and that the county caused it to be a lot steeper. Also, I shouldn't say the county; it was designed.
Yeah,
the hill needed cut down. It definitely needed cut down.
And I looked at it,
And to that point that you're making, whether this precedent is an issue or not that it's being created and it was designed to specifications, in order to make that a 10-degree slope would have been much more expensive because the crest of the hill sits at or near the right-of-way, and so your grading would have had to extend clear back to nearly the front of the house in order to hit a 10% slope. And so it would be more cost-effective to relocate the driveway than it would have been to try to regrade that to a 10% slope, whether the water line was an issue or not.
And you'd be on the other property to the south.
but that's
slope it back.
But now that's what we're doing. So
moving the driveway.
Moving the driveway. I'm saying as part of the original design,
Yeah.
whether we do it now or do it then, it would if we were to have a 10% maximum slope as a county standard for a driveway entrance, it would have been much more cost effective to relocate the driveway than to ever grade that hill down to a 10% slope, because we would have had to grade it back probably an additional 30 feet, and that house does not sit that far back.
and I understand exactly, and that's exactly my point. If we change it to be 10 degrees, then in the design we'll say, well, it's going to be cheaper to move the driveway than to meet the 10 degree. I think that's just my opinion.
I agree with Commissioner Culberson. Maybe going forward we can figure out a policy for that. Maybe you can bring that to us down the road.
We have our road design standards at some point in the future currently are quite old, and I mean all of these things at some point over the course of the next year probably need to be examined and considered.
Sounds like a work session.
Well, one of the things I would bring up on that, the point that you're making is we do have a standard. It's 15. Because that's what KDOT standard is, and we just use KDOT standards. Sometimes those standards on the highway don't necessarily match up what would be what in this case is probably considered more of a residential setting. But that's why there's an issue here is that we do have a standard. That standard is 15. This homeowner is asking us to step away from that standard, so it's a one-off consideration.
Yeah. And that's all I'm saying is maybe we need to address that, what the standard is. So we're not saying, well, you did it for them. Why don't you do it for me? I hate those situations.
So do you have a motion on the floor?
I had a motion for my.
I didn't get a second.
Well, no, but what was the motion?
What was the amount not to
What was
exceed?
the-
10,000. That was the amount that you used.
Not to exceed 10,000.
Yeah.
I'll second that.
Motion and a second. We have any more discussion? If not, I'll call the roll. County Commissioner Cos?
Yes.
Colson?
Aye.
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 Motion passed. Thank you.
Thanks, Bill.
Commissioners, I did have one other item that I wanted to bring up under administrative business. This is a discussion that this is kind of a thing that's been ongoing, and Bill and I have had recent conversations on it, so we just wanted to get a little bit of clarification and maybe provide some clarification. A few months ago, we put out a request to the cities for projects they may have that the county could match with them or participate that would increase like economic development incentive. At the time the board decided to do that, we had two projects, County Road 30 and then 158th Street south of Vaser, that we had put on kind of on the table back burner because we didn't have funding for them. But we had also applied for grant funds at that time. So the Board of County Commissioners had said, well, with those two projects being pushed off a few years, we have this money available that we can use to partner with some communities, and they submitted requests. But what happened since then is we received a grant funding for 158th Street. So the board decided to pull that one up and put it back on the priority list. Before we scheduled a work session to go over these applications from the cities, I wanted to make sure that the board understood that to move forward with that, to provide those matching funds, would likely result in either a debt issuance or pushing back one of those projects that the County Road 30 and 158. So I just wanted to make sure that that's still the direction we wanted to go. Again, we thought we weren't sure we were going to get the grant funding, so we started the program, but we did get grant funding. So 158th Street has been moved up. So do we want to revisit that, or do we want to send a letter to the cities and say, look, right now those funds are no longer available, but in 2 years they may be, depending upon how Eisenhower finishes out. Because the Eisenhower project is going to have a big impact on when funds are available and what we have. So just wanted to bring it up today. We can schedule a work session if you'd like on it, but really I'm not sure that we have the funds. I know we don't have the funds that we originally anticipated because of 158th Street moving forward. And I'm not sure that we would have the funds available without issuing some kind of debt to do that, and that wasn't what we were contemplating when the whole thing started.
So if I got this right, we went out and asked the other communities to submit for this grant or for this the funding that was available. Now we're going to tell them it's not available because the state has made money available for an old project that was set up by the county commissioners a ways back. Is that correct?
That's what I'm asking, if that's the way you
Yeah,
want
but is that the way it occurs?
That pretty much sums it up.
Okay.
Or
There's a few more twists and turns.
are there any of the cities that have submitted any projects yet, and are they matching fund projects?
Well, I think we had, yeah, you can cover it, but I think we had several proposals. Each city, Leavenworth decided not to because of another project that we did that they had already had on their radar, and the county had already completed it. So they withdrew any request they had. But Lansing, Tonganoxie, and Baser all submitted projects to this.
Tonganoxie?
I think they all submitted projects. So
How much money can we send that way?
it would be again, it was, we solicited it, and the funds have been, I guess, appropriated towards a project that we were able to actually get a pretty sizable grant for.
Okay. Well, we don't want to lose matching funds by any stretch. I mean, they're hard to get. So when we get awarded something, I'd hate to say, sorry, we can't do it. We'll send the money back, because the next go around, they're not even going to consider you.
Yeah, I've seen that happen before. The other option is
That's where I'm stuck, because I'm not going to vote for anything that puts County Road 30 off even further,
Right.
because it's been on the back burner for 25 years. But like you just said,
25.
I hate saying no to matching funds.
Yeah.
Well, you were going to have to say no to a couple of them either way. And so what the three applications you received were, one is a roundabout for the city of Lansing. That was their MARC application that they did not receive funding for. One is a cost share for the remaining portion of 155th Street for Baser for the approximately $3 million that they have remaining after their grant to cover the cost of that project. They did receive $7.4 million from the Mid-America Regional Council through their application process, but it will cost an additional approximately $3 million, I think, is what I was told. And so they were asking for a 50% match for that remaining portion. And then the third application was for the city of Tonganoxie, and it was some improvements in front of the school on Evans Road, and then the development of a new road on 13th Street that was part of a KDOT plan for access management to 24 Highway. The intent that I was giving direction on when we had our work session and what we sent out the applications for was for projects that were near or adjacent to cities that were currently maintained by the county, that if the county cost shared the cost of the project, then the city would then take over the maintenance of responsibilities for that roadway in the future. That was the direction we were provided. And so two of the three projects only loosely are associated with the criteria you guys had us send out. And so that I think that we could have a work session, we could notify them, but we did send those out in October, the October time frame, early October, and so we've had several months since they've been turned in, and we have been asked for responses from the city administrators and public works departments of those entities. And so whether we have a work session or you provide direction here today, I think that it would be appropriate to give them some response.
Because here's the ironic part, Commissioner Smith. The reason County Road 30 is not paved now is because we said no to matching funds. So
Well, we missed it on the Tiger funds because we didn't have a project on the shelf. Prior commissioners would not allow for paying for designs and to have a project on the shelf, to have a shovel-ready project to submit to KDOT.
which is why I always push for, even if you don't have the funds, just get the project on the shelf.
Spend the money on the design and have it done. Have your right-of-way purchased, utilities relocated.
Because I've seen
ready to go.
I've seen a lot of projects get done because they didn't have funds to begin with, but they were on the shelf ready to go when the funds showed up. So.
That is the case for 158th Street for the grant that we did receive for the cost share program. Maybe not every single one, but 90% or more. Maybe one remaining easement needs to be acquired or two. But they did acquire all of those easements, and I believe in 2009. A lot of the utilities were relocated. We may have a few conflicts left, but the majority of the conflicts that were in place were resolved in about 2009. So, and the right-of-way was acquired by staff in about 2006 after the plans were completed in 2004. And so a lot of that was ready, and that was part of our application process for that grant.
That's 158th Street?
158th Street.
Yes, okay.
So if I mean, even if we send them a letter and we tell them that funding's likely not available at this time, let's say, some folks are in charge in Washington that like to spend a lot of money, and let's say we get an infrastructure bill through, and then money funnels down to us, these projects are still something that we could, at that point, fund, correct? Or how would we approach that?
That would be for them to apply for those funds more than likely, since
Yeah, but I guess what he's saying is if you're waiting 2 years because we didn't think we had the funding before, and now that project is coming back, which I understand, these projects should be sitting the same way. If the county commissioners want them, they would be on the top of the list if the county commissioners want them to accept the funding next and not have to start the process over again.
And Mr. Chairman, I think that's why we need to have a work session to rate these projects.
Okay.
I do think
That's fine. We can. It's just wanted to make sure where we were going.
We can
with
rate
that.
them on return on investment too. I'm still waiting on a return on that investment down at Tonganoxie.
we're going to hear about that a lot.
That's a lot of money down there, Mike. I'm telling you.
Mike, I may chime in with him a time or two on that, but go ahead anyway.
So we'll schedule a work session, and that's all I wanted to bring it up for. It's not to evaluate the merits. It's just whether or not there was even a point in that, given that there's likely not funds, unless the board understands that we could issue debt to fund one of them too. But anywho, so we'll schedule a work session then.
Okay.
And when we do that, we will invite the applicants to be here for part of that, as part of that.
That's
work
great.
session.
Okay, thank you.
Question for Mark, and maybe, I don't know if it's been already addressed internally, but has this Eagle Crossing subdivision issue been resolved as far as them being able to get their building permits? Or where are we at on that?
Well, I guess we can discuss that in administrative business. Do you have a problem with that,
No, go
Mr. Chairman?
ahead.
Yeah, I received a call about that. That the county has not accepted the road on that, the asphalt issues. They're not going to get worked out anytime soon. I would not believe they're going to get worked out anytime soon, and it's definitely not going to get repaired till the weather warms up. I don't know how many building permits are being held up.
I think 17. Was it 12 or 17? 12.
There's difference between lots sold and building.
Oh, there's no or you haven't applied for building permits yet? Okay. Well, they would like to get building permits on this till we get this thing worked out and between the contractor, and I know it's against policy, but we've also changed. If the county never takes it over, it becomes a private road. Now that we've allowed private roads, or if there's some kind of way they could put up a bond or something while they're trying to get this worked out between the developer and the contractor on the road,
So
if they could get building permits.
I'm sorry.
Go ahead.
A little background. The road is in a private subdivision. When they completed the road, we went out for the inspection process, and it's not acceptable to county standards. So we notified them at that time. You got to bring it up to the standard or you got to meet basically a deliverable product before we can accept it. By policy, we can't issue building permits on a road that's not been accepted into inventory, because that's that's kind of the, how do you make sure they follow through and fix it, right? So that's where it's at. The developer has come up with a few scenarios and the one that I think is probably most feasible, if they're willing to accept the fact that it needs to have an overlay done to fix it, that they could give either like a bond or a irrevocable letter of credit for the amount of the project, and then we could issue the building permits, and come spring when the asphalt plants open back up, either they get out there and fix it, or we have this bond or irrevocable letter of credit that would allow us to. Yeah. The only thing that we would be concerned of at all is that they don't fix it, and then the county is on the hook to get it done. So that covers that if we went that direction. I don't know that. Yes, I don't know that the developer is willing to accept that. I'm just saying that is the scenario that allows them to get the permits that they need to move forward.
I think they would be.
So if the board would accept that, and if you could give us that direction today, we'll work out the necessary documents to make that happen. and we can get it probably done really quick.
What'd you say, Mike? They would or would?
I think they would.
And that's definitely a way to go. That's a good compromise. I've seen it used before because it protects everybody.
Right.
I like that, Mark.
And they're not out anything. If they're going to fix it in the spring anyways, we're not tying anything up for them, and they can get moving. And we know they want to be building this winter.
I'd rather see the roads get the concrete trucks and the lumber trucks and the gravel trucks all on it, and then
Before
finish surface
they finish
on it.
it.
So, and that's also it's not going to get worked out anytime soon. I'm sure the developer and the contractor are in discussions on who done what and who should have done what.
But as far as what Mark said about using the maintenance bond, basically what it
Right.
is,
As long as
I don't have an issue with that. Does county commissioners have anything on that, or at least give them
As
some
long
kind
as
of
we're
direction?
protected.
Yeah, exactly.
And this will prevent a delay of the construction.
And that seems to be the only thing that's driving this train right now is home building.
So if everybody's okay with that,
You need a motion or just a direction?
Well, I think because it's going to be an exception to policy, I think I would like a motion by the board to direct staff to make the necessary arrangements to get a maintenance bond or something similar in place and allow this group to move forward with construction.
I'll move to authorize staff to contact Eagle Crossing Development and to get a maintenance bond for the necessary repairs to allow for building permits to go forward.
Second.
motion and second, discussion on this. If not, Commissioner Stephen?
Aye.
Commissioner Smith?
Aye.
Aye. Commissioner Culberson?
Aye.
Commissioner Cos?
Aye.
Thank you. That got you, Doug? Good? Okay.
Good.
Consent agenda?
Unless we have any more administrators.
I don't think Mark said no.
Do we need anything taken off the consent?
I do.
You do?
I need Ackerland Hill taken off.
I move that we accept the consent agenda minus Ackerland Hill.
Second.
Motion and a second. Commissioner Cos?
Aye.
Mr. Culberson?
Aye.
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 I move we accept the Ackerland Hill section of the consent agenda.
Second.
Motion and a second. Any discussion on that? Mr. Stephen?
Aye.
Mr. Smith?
Abstain.
Aye.
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 Passes. Excuse me. For formal board action, this is considering a motion to approve a grant revision for subdivision to state for Council on Aging.
Commissioners, actually, I've met with the Council on Aging director, and what's going on is right now from the federal level funding for the Council on Aging, which basically for meals, it funnels through Wyandotte County. We have not received the funds that were originally allocated to us, and we're not 100% sure that we will. But in talking to the Council on Aging director, this really, from our standpoint, because our budget year does not mirror the budget year of the federal government, we can consider this later in the year and give it time because it may play out where this money actually does come in. We still have approximately 8 months for the federal government to free funds up, so no reason at this point, I think, to consider this revision. So we could just move this off the agenda.
Okay with that?
I think that's a good idea because it gives them time to fire up the printing presses.
Yeah.
True statement. Okay, thank you. Consider a motion to approve Board Order 2021, creating a Board of Building Codes appeals for the purpose of hearing the appeal of persons agreed by the staff, interpretation, application of building codes. Come join the fun. Good morning.
Morning, Crystal.
Good morning, Crystal. Alrighty.
Smith, you did a great job of summing that right up. I have before you a request for a board action to establish a board of appeals for the building codes. My department will put together an application form for the commissioners to review, and then we'll send that out so that we can get that board The board should be at least 5 members, certainly not more than 7 members. We want to make it so that the board can very easily convene. So one of the provisions within this board order is that it could be done via Zoom or phone call if need be, and that a quorum would simply be 3 members. We do not want to hold up the building permit process, certainly. So we feel that by putting these things into place that we'll be able to keep that moving pretty smoothly. As such, we certainly, our recommendation would not be that these appointees are made by commission districts, that if they're all from Leavenworth or Lansing because they're building official or building professionals, then certainly that's okay. We have other committees that we do want it to be more representative of the county, but in this sake, we want people who are qualified to sit on the board, so that would be our recommendation.
Mr. Chairman, I just wanted to ask a question of Crystal. Now, this board order, it doesn't say whether it's going to be 5 or 7. Personally, I just would like to see 5 instead of 7. But I know sometimes you have trouble with 5 being able to show up all at the same time, too.
Right, which is why we say a quorum is obviously 3. Granted, if you have 7 members, then that gives you a little more flexibility. Right. However, I agree with you. I think 5 is certainly plenty.
Yes.
Okay. So if the board, we can make that.
So by just passing this board order, then it just allows you to start a public notice or
process.
Send it out. Okay.
Yes.
Solicitation.
Unless anybody has any more questions, I'll make a motion.
Certainly, if you have anyone in mind, please point them that direction.
We know how volunteers are.
We don't want to volunteer. So I'll move that we approve Board Order 2021-1, creating a Board of Building Codes of Appeals.
Second?
Motion and second. Any discussion?
Go
ahead, Mike.
One piece of discussion is, and you can address when we will be able to visit or talk about 2 items. One would be the entire county being included in the building codes, and the second one would be on event centers, whether the sprinkler requirement should be the square footage changed. So would we do that in a work session, or how do you see that as being something that we could resolve or discuss at least?
I'll weigh in on that. The board has already approved the building codes. They just voted to hold them in abeyance. So once this committee is formed, it'll have to come back to the board to basically reenact those. If you had any questions at that time or any items, you could discuss it at that time. But it has been discussed previously. The board approved a certain set of building codes that we would be implementing, and who and where it would be applicable. So once you did that, from a staff's perspective, that's where we're moving.
Mark, let me ask you this then. These things are up for review in June. Is that correct? Do we review?
I think annually they will be reviewed.
Of June.
Yep.
So if someone had an issue or someone wanted to speak upon it, not just county commissioner or something like that, they would contact who? Crystal, you?
Correct.
Okay.
They would contact our office if there were.
And I know, Mark, you know what we're talking about. We've already seen a couple of them come through.
Yep.
I just want to be able to give people where they can go to have their day in court.
Yes.
Not saying it better. Not that we change anything, but just to be able to be heard. Okay.
But since we're just now initially implementing this,
exactly.
We're going to get another resolution back here that'll finalize all this. Is that correct? Or
Well, it's been finalized. You just voted to hold it in abeyance. So we're not doing anything
Okay.
with it right now until we get this committee going. Once the committee's going, then you will, basically it's, I'll compare it to putting something on the table. You've tabled it. You'll have to take it back off the table once this committee's ready to go. So that would be the time you can make any discussion if you wanted to change it.
okay, so that was all I had.
Okay. I have a motion and second on that already.
Oh, did you get a second?
No.
Second.
Yes, yeah, you had a second.
Okay.
Commissioner Cost, seconded.
Thank you, Commissioner. I'm getting old. I forgot. Okay. Any other comments on this? Commissioner Cause? Take the vote. Commissioner Cause?
Aye.
Commissioner Cobleson?
Abstain.
Aye.
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 Okay. Direction given there. Next is executive session. We go to next. Doug.
Do you want to do presentations?
Yeah, we might do. Is there any presentations or anything before we go into our executive anybody wants to bring up?
Well, I'll start. I had went to, let's see, I did the candlelight vigil Friday night here at the courthouse. I attended JCAP via Zoom on Thursday. Done Mid-America Regional Council yesterday, Zoom, which had a lot of stuff that kind of pertained to what we talked about this morning with Jamie. State of Missouri has already released the names of the approved vaccinators. Kansas has not done that yet. And I'm assuming by approved vaccinators it meant the pharmacies and hospitals are going to be approved. But they don't have vaccine either. And there's some other things. I think that's, and I have Baser City Council tonight, and I have Fairmount Township Board meeting tomorrow night. And we may be getting from Stranger Township asking for a letter of support for KDOT. They would like you know where the Stranger Township Fire Department is. They don't have a crossover to be able to go both ways out of their fire department. They have to go down the road, turn around, come back. KDOT's denied that in the past, but if they may be asking us for a letter of support for KDOT for a crossover. And that's all I have.
I've got just one. Lansing appointed Ron Dixon to fill a vacant seat out in the council. He'll be on this year. Known him for a long time. I think he's going to be definitely an asset to him out there. And that's all I have as far as Definitely.
On the 25th, there's a meeting at Sherman Township about possible formation of a fire district. That meeting's going on. The tornado relief from property taxation on outbuildings has been reintroduced, and there's going to be a hearing in the Senate, and I understand that the representative from Tonganoxie and the representative from Baser have introduced it on the House side. So it's the exact same version as last year with the addition of commercial property to the bill. And other than that, we're also through the end of February. We've so far 20-some backpacks, new blankets, caps, gloves, things that we're going to, necessities that we're going to give out to homeless and folks that are down on their luck.
I've seen them, pretty impressive.
And we've had pretty good participation. A couple of churches have jumped in, and anybody that wants to, this is something that's just community. We're just doing it.
Till the end of February?
Yep.
Okay.
Met with the folks doing the drone video for the Eastern Gateway and finishing that up so I could get on the schedule for Lansing City Council meeting.
And I think they've got you scheduled there too. A preliminary.
Second. Yeah. I think second week.
And Jeff, if it's all right with you, I'll tag with you.
Absolutely. Yep. So I got on their schedule for that, and then met with Easton City councilman to talk about cleaning up some health hazards in the city of Easton. So.
Vicki?
Let's see, did the Adult Advisory Board last week. Also, with Commissioner Culbertson, we did the Port Authority meeting yesterday afternoon. I participated in one, but not both of the Workforce Partnership. I couldn't get logged in onto the CEO. The link wouldn't work for the Zoom, and I couldn't get them to answer to me to get me the link again, or get me a link. But for the had an update, just some of the things that are going on in Workforce Partnership, and they continue to. People need to really take advantage. If they're looking for work, there are opportunities out there, and the Workforce Partnership Facebook page is a really good place to go. There's a job fair that's getting ready to happen, statewide job fair that with some of the employers within this local region, and I think that that's something that we need to encourage people to look at.
Is that Kansas and Missouri?
Well, right now, this is the Workforce Partnership really for the state. But I think there are employers that are employ in Missouri, but the job fair is the workforce partnership for the Kansas area, like our area. So.
But it includes Mark, which is partial Missouri.
Right, it includes.
Metropolitan area.
Yeah.
Yeah,
They would love Kansas workers to come over and pay their earnings tax.
Yeah, but there are opportunities there.
Yes.
We have people who are struggling to find employment. There are opportunities, and people need to take advantage. We have the place on Limit Street that they are scheduling appointments, and people can go in and continue to update their resumes or get some job training, things like that. So I just think that's something that I think we really need to emphasize to individuals. And then, although not part of what I'm supposed to do, I from time to time listen in on the hearings that are happening in Topeka if they kind of relate to the county things, and so there's things going on there. But one of the things I found interesting was that the health committee did a joint meeting yesterday, and I think there was something in the Leavenworth Times, I haven't read it, that discussed some of the things that Mr. Norman had put out there. But something that I found fascinating within that report when they were talking is that 22% of the blood donors in the state of Kansas, like when they donate blood to the blood, 22% have tested positive for COVID, or have the antigens, have the antibodies, the antigens, which is actually greater than the number that they're estimating that have been exposed. So I just thought that was a really interesting little that was put out there, and I thought, oh, that's fascinating. So I took a note of it just as a conversational thing. I thought that was interesting. But if you ever have the chance, you can go in and listen by audio when different committees are meeting.
Yeah.
I listened to the meetings when some things haven't passed out of committee. The LABTR did not. It didn't pass for a vote. But those are I'm just saying those audios are available to listen live, and if you have time, sometimes you can garner information.
Well, you work at your day. Yeah, absolutely.
Well, just.
I had one alibi. I visited with Chad, as county commissioner, yesterday for a couple hours. I just wanted to chat with him on some things. Found it very informative. So I just wanted to say I enjoyed the couple hours that he and I spent together. Is there anything else besides before we go on executive?
Well, I just think one thing that came up with Senator Pittman is at some point down the road. I think we're fully updated on the health issues now, but he offered that we could have Mr. Lee Norman or Dr. Lee Norman and some people from the state. I think we should take advantage of that.
Absolutely.
I agree. I thought it was a good point. I agree. Anything else? Someone wants to listen to executive session?
I move that this board recess from open session and go into closed executive session to discuss personnel matters of non-elected personnel as justified by KSA 75-4319B1 and to protect the privacy interests of the persons involved, and that this board resume open session in the meeting room at, how long do we need?
If we could go 20 minutes for this one.
10:50. President of the executive session will be Commissioners Culberson, Kaz, Smith, Stephen, and County Administrator Mark Loffer.
And the sheriff.
Oh, and County Sheriff.
Motion?
Second.
Motion and a second.
Is county council supposed to be in there too?
Oh.
I don't know if you don't need to.
Commissioner Smith, I did visit briefly with Mr. Loffer on this. I don't believe my presence is necessary, and I do have other matters.
Okay. Thank you, Dave. Got a Commissioner Cause?
Aye.
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 All right. We're heading into executive session. We need to make no decisions were made. Discussion was limited to non-elected personnel. So we need a motion. Do we do a motion up here to come out of the executive?
Or just return.
Say what it says.
Was conducted.
Okay.
I move that this board recess from open session and go into closed executive session again for discussion of personnel matters of non-elected personnel and justified by KSA 75-4319B1, and to protect the privacy of interest of the persons involved, and that this board resume open session in the meeting room at, how long do we need?
Time.
Maybe another 20 minutes.
Okay.
11:10. President and executive session will be Commissioners Culberson, Cos, Doug Smith, Mike Smith, Stephen, and County Administrator Mark Lawfrey.
Second.
Motion and a second. Call roll. Commissioner Stephen?
Aye.
Smith? Aye.
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 Okay, back to open meeting. No decisions were made. Discussion was as between listed limited to non-elected personnel. So I guess we're back open now, and
Nobody's waiting to speak that was
We have no
before.
public comment.
No public comment.
I move that we adjourn.
Second.
motion and a second to adjourn. Commissioner Cos?
Aye.
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 Aye.